Hello and welcome to yet another episode of Hair Talks by Terra Medical. My name is Dr. Joshua Chong, and today we're going to be covering some questions that have been asked on our YouTube channel. They cover a whole range of topics, so stay tuned as we go through them one by one. Okay, question number 1. Hi, can I make a paste of oral minoxidil tablets and apply it on hair? Now, this is an interesting question because minoxidil is originally supposed to be used as a tablet for hypertension, but later it was found that it was useful in growing thicker, stronger hairs, basically eliciting a hair growth response. The very clever pharmacists have formulated it into a spray or foam version, thereby negating you having to use the tablets to create your own solution to apply on your scalp. And there's a very special way of doing this, and almost every company that produces minoxidil spray or solution will do the same thing. They'll mix it in with a bit of alcohol as well as propylene glycol to allow for better penetration of the minoxidil compound into the scalp. There is no advice given as to how to make a minoxidil tablet that usually contains fillers or other substances to stabilize the tablet or colorants into a solution form, and I suspect that you will not be able to achieve much success with making such a paste. Question number 2. Hi, I was subjected to an attack from a person. I shouldn't say what the person described the person as, and she grabbed on my hair and pulled it aggressively on a couple of strands, which kind of collapsed from the root or follicle. I assume this means that the hair fell out. Is this kind of force traumatic or not enough? My scalp had a burning sensation for a couple of days after the attack in a couple of spots. What do you recommend? So I guess the person is asking whether the hairs are going to grow back if you forcefully pull hairs out from the scalp. And if it was a one-time event of pulling out the hairs without using any cutting force to the scalp, it's very likely that these hair follicles will be able to regenerate new hairs. However, the symptoms of pain and burning may suggest some other pathology. For example, infection or areas of broken skin, or something else might be going on that warrants further investigation and examination. So consult your dermatologist or hair restoration doctor if you're concerned. Question number 3. Why don't they just supply minoxidil sulfate in the first place as a topical application, thus eliminating the need for the conversion in the body? Anything that goes through the liver is mostly neutralized in a couple of passes. So this question pertains mainly to the use of minoxidil either orally or topically, and why do we use minoxidil in its pro-drug version rather than in its active version, which is MS or minoxidil sulfate. I'm sure many pharmacists have tried to produce minoxidil sulfate, but the polarity of the molecule probably makes it less transdermally available. In other words, if you're going to apply minoxidil sulfate onto an area that has a thick barrier such as a scalp, it requires quite a lot of fat solubility for it to get through, and water-soluble molecules usually have limited success in doing so. The molecule might also have a higher molecular weight, thus not allowing it to penetrate deep enough into the blood vessels of the dermis at the scalp. If you're talking about ingesting minoxidil sulfate, the pharmacokinetics of minoxidil sulfate a little bit strange. If you're going to ingest minoxidil sulfate into your stomach, it still goes into your liver and goes through further breakdown. And we do know that minoxidil sulfate, if measured in the bloodstream, probably lasts not more than 30 to 45 minutes anyway. So the pharmacological effect of ingesting minoxidil sulfate is probably quite poor. Question number 4. Hi, I have done a hair transplant. After how many days of hair transplant is it better to do Regenera Activa? And do you advise to do it together the same day with PRPN or better individually? Okay, so this patient is asking about when to use regenerative techniques in relation to a hair transplant surgery. And there's no right or wrong answer in this, and different practitioners will recommend different things. Typically, I would use Regenera Activa on the recipient area of the hair transplant if I suspect that the graft survival rate may not be as high as what I want it to be. For example, in microvascular disease like severe diabetes, heavy smokers, or chronic hypertension. So this will improve the graft survival yield. According to my experience, there are certainly no papers that suggest this is true. Not enough research has been done in that. However, some other practitioners prefer to do it some months later after they start seeing the initial growth of hair. This can be then strategically done to either the recipient area or to other areas of scalp to catch up in terms of density to match the recipient area. So that might take 6 months after the initial hair transplant for you to be able to gauge which are the areas that are best targeted with Regenera Activa or PRP. Question number 5. Okay, Mr. Joshua, thank you. Thumbs up. So you suggest Nocrin? Is it safe? Does it damage testosterone as Propecia? Okay, so the patient is alluding to more about the androgen affecting pathway that finasteride or Propecia does. It is actually known that Propecia does not damage testosterone in any way. It actually just inhibits the enzyme that converts testosterone to dihydrotestosterone, as we have covered in a different lecture series or different video. Nocrin is pure extract of fish and contains a bit of additional fortified biotin in it. So there's no component of Nocrin that is hormonally active in that sense. It will not adjust your DHT levels or your testosterone levels in any way. It's safe to use in most circumstances. However, taking high levels of biotin can affect certain blood tests, such as your thyroid function tests. So I usually tell my patients to stop taking any biotin-containing supplements 7 days before they go for any routine health screening tests. Question number 6. I have been taking dutasteride for about 5 months and 14 days, but to date, I do not see any results. Should I wait longer, or combine finasteride and dutasteride, or switch to finasteride only? Also use minoxidil 2 ml daily, by the way. Okay, so this patient is actually asking why is it taking so long to see any results from the combination of using topical minoxidil and dutasteride. Now, dutasteride, if dosed the daily at 0.5 milligrams, may take up to 6 to 9 months for you to produce any significant improvements in your hair. But a point I want to bring about is this patient did not actually show us how his hair was like at baseline. And it's important to take photos before starting any kind of treatment so that you can gauge at certain junctures throughout the year whether the hair is actually getting thicker or not. And this should be done under constant lighting using the same camera, same zoom, same aperture settings, same exposure in order to get comparative photos. And we do that in clinic before we start any treatment, and we do that at intervals of 4 months, 8 months, 12 months if we are starting our patient on dutasteride. And to answer the question whether you should switch to finasteride, dutasteride is way more potent in terms of reducing the DHT levels as compared to finasteride. Dutasteride actually lowers DHT levels in the blood by about 90%, whereas a 1 milligram of finasteride would lower it by about 60 to 80%. So if you're finding that dutasteride is not working for you yet, 2 things should be done. First, wait a little longer. 5 months is a bit of a short period in order for you to see results. And 2, if dutasteride is not working, you probably need something a little bit more rather than a little bit less like finasteride. Question number 7. Can using Dermapen 2mm cause permanent damage to hair follicles? Please help me. I've done this many times and now I note receding in my hairline. Is that damage permanent or can grow again? Okay, so this questioner is actually finding out whether or not the settings for Dermapen, which is a microneedling device, is suitable for restoring the hairline. And if the hairline has seemed to disappear after using this treatment protocol, will it regrow again? Now, I think a few things come into this question to answer it in a holistic manner. The first thing is hairline recession may not have been caused by any kind of treatment, but could be a natural progression of male pattern hair loss. So it may not be permanent damage or damage at all from microneedling. Secondly, Dermapen as a treatment to be done at home should not be done quite so deeply at 2mm. So the recommendation for microneedling treatments at home would be somewhere in between 0.5 to 0.75 millimeters of depth and to be done twice a week. Now, dermapen settings can go as deep as 2.4mm, and that should only be used in a clinical setting for transdermal drug delivery and not for the restoration of hair follicles. Question number 8. My question is, I am working as a motorcycle delivery man. Do you deliver motorcycles, or do you ride a motorcycle for delivery work? If I do a hair transplant, how long until I can wear a helmet and start work? Okay, so I believe he wears a helmet daily and rides on a motorcycle for delivery work. It really depends on how your hair is, or rather your scalp is healing after a hair transplant. Usually I advise my patients to, after the first week, use a bandana to cover the entire scalp before putting on your motorcycle helmet. And this bandana should be cleaned or changed every day. And you can find them very cheaply online, and use them as a protective barrier between the motorcycle helmet sponge or supportive, inner lining. A barrier between the inner lining of the motorcycle helmet and the newly implanted grafts. So these bandanas should also not be too towel-like in nature because they tend to tug at the newly implanted hairs, but get one that's smooth and cotton and breathable, and something that you're happy to just throw in the washer and don't have to hand wash it because it's going to be a lot of trouble. So 1 week's the answer. Question number 9. With any hair transplant techniques, there will always be scarring. Is this true? Yes, it is true. Anyone who tells you they can do scarless surgery is lying to you. So even with the FUEE techniques, follicular unit excision and extraction, the smallest of punches will still cause a scar. It's just whether the scar is appreciable to the naked eye or whether you need a microscope to have a look at a scar. But I would say, as a default, in Asian hair, we tend to use 0.9mm to 0.95mm of punch diameter. That's still less than 1mm, but if you shave the head completely, there are on occasions certain people that you can notice pinpoint white little dots that scatter across the donor area if hair transplant was done. Question number 10. And this pertains to, I believe, Regenera activa, because the questioner asks, when the doctor extracts some tissue samples, does that mean he extracts some hair follicles? So will I lose some hairs in the donor area? If so, it would be a bad idea to do Regenera activa multiple times. Okay, so to address that directly, the intention of Regenera activa sample harvesting is not to remove hair follicle units like a FUE. However, any punch biopsy that involves a large enough area, 2.5mm in the case of Regenera activa, will inadvertently remove a couple of hair follicles from that region. Typically, this is not going to be noticeable even if you shave your scalp, if done correctly. So there are practitioners that I've seen do Regenera activa erroneously by following the axis of the hair shaft in order to try to extract the whole hair follicle. That's not the conventional practice. The conventional practice is to go perpendicular to the skin, and some of the hair follicles may be lost in that area, but hair will still grow back from the surrounding areas. So some of the hair follicles may be lost during that punch action, but it won't be that numerous, and you should not be able to see massive bald areas if you trim your hair really short. I just want to follow that up with how do you strategize doing Regenera activa multiple times. So you have a fairly large donor area, and we don't always have to harvest tissue from the same spots for Regenera. So in my patients who I've treated over many years, who have done Regenera more than 2 times, I usually alternate spots. So we go for one down the left side and then the right side, and we alternate to the left again, avoiding the harvesting over the previously harvested areas which we can see with a microscope. Thank you for those questions, guys. They were very interesting, and keep engaging with us by leaving more questions in the comment section below. And I look forward to seeing you on the very next episode of Hair Talks by Paramedical. Cheers.